Okay, now for section 2 of our chapter 13. So problem solving is going to be an important asset for the pharmacy technician as well. So dealing with difficult patients sometimes, like I said earlier in part 1, you want to make sure that you're calming a patient down who does not want to wait the estimated time or does not understand why prescription insurance plan is not covering their medication. So I always tell people first, always let the customer speak and go ahead and let everything they want to tell you out, and do not interrupt them, because that could just make things worse. Once they have finished talking, you can just say, um, Miss Hall, I understand. If it's an insurance prescription plan problem, you can offer to call the insurance company and try to resolve the problem. Um, but to me, if you do that prior to the patient coming in, then you have already eliminated a step of having the patient get upset. Um, but again, you want to make sure that you know how to deal with difficult patients. So if a patient's upset, first thing I tell people is always let them finish fussing or complaining about what they want to complain about. I always understand what they're saying, and then either refer them to the pharmacist or try to resolve the issue problem yourself if it is something that a pharmacy technician can do. Staying focused at work, of course, when home or school issues threaten to interfere. So it is hard at times, especially when you have other problems going on with, like if you're going to school and working, or if you have problems at home and having to work. It is hard at times, but you need to stay focused at work in order to prevent any type of medication error. Also, dealing, of course, with work disputes through rational, calm, and private discussions as well. You do not want to argue with another customer, or not a customer, another uh, healthcare worker in your pharmacy where customers can see that. Okay, you never want to argue with a customer either. So, discrimination and harassment, of course, are unethical and illegal and are not tolerated in any workplace. So, discrimination will be to giving someone special treatment or mistreatment. Harassment, you're going to have mistreatment, sexual or otherwise. Um, you do not have to put up, of course, with off color or crude jokes if you do not wish to hear them. Um, you need to refer them to the pharmacist on duty or also the manager. So conversely, you must not create an environment either that is uncomfortable for your coworkers. So terms to remember is that with your policy and procedures manual, this is a book outlining activities in the pharmacy, defining the roles of individuals and listing guidelines. So many pharmacies are going to have their own policies and procedures covering a wide range of activities, which can include your technician responsibilities and customer care. Make sure you are familiar with these guidelines in your particular pharmacy because they can vary from pharmacy to pharmacy. Discrimination, the definition of it is peripheral, I'm getting tongue-tied, excuse me, treatment or mistreatment. Harassment, which is a mistreatment whether sexual or otherwise. So here are some more questions to think about while you're studying. What are some ways a pharmacy technician can demonstrate good customer service skills and demonstrate the right and wrong ways to go about daily interactions with the pharmacy customers? So a lot of times, and the reason why I'm focusing on retail pharmacy is because you deal with a lot of customers, and that's what Chapter 13 is really about, customer service and attitude. Um, is in a retail pharmacy, you know, some people say you got to be quick, and in a retail pharmacy, you want to be accurate in retail pharmacy when filling the prescriptions, and you also want to have good customer service skills. So those are one of the main important things that pharmacists are looking for in a pharmacy tech for a retail place. It's not so much that how fast they are in getting everything done and completed, it's how accurate they are and how good they are with the customers. Here is another outline of what we're going to go over. Professional behavior, teamwork, interprofessionalism, do not dispense medical or pharmaceutical advice, emergency preparedness. So healthcare professionals are expected to abide by both written laws and ethical guidelines. So it also includes a commitment to decorum, and what that means is it is the proper or polite behavior that is in good taste, and adequate. Etiquette is an unwritten rules of behavior. So it shows respect to your healthcare colleagues, and if you are in doubt as to expected behavior, watch and learn from a suitable role model. So decorum, an example of it is, you want is proper or polite behavior that is in good taste. So arguing with your supervisor in public is an example of an inappropriate decorum. So that would be not good. Etiquette is an unwritten rules of behavior. So being disrespectful to a physician is an obvious violation of etiquette. Okay. So pharmacy technicians and pharmacists, of course, must work together as a cohesive team. So it is very important that you get along with the pharmacists that you are working for and co-workers as well. So you want to show respect for your co-workers. A lot of times, just in pharmacy, people do have different personalities, and you may clash a little bit. But it is important that while you're at work, that you do not allow those differences to interfere with your work. You always want to show respect for both your coworkers and the pharmacists and managers that you're working for. Using common courtesies can make a difference. So, as an example, could you please call the insurance plan and verify this patient's coverage? Um, or thanks for staying late to help us get caught up. A lot of times in retail pharmacy, if you're on the morning shift, and so your shift gets off at 5, they ask you to stay a few minutes over. A lot of times it's very courteous of you to stay over, and they expect it a lot of times as well if they are behind, because the patient does come first, and they want to make sure that they are serving the patients and the customers as well as they can. So if you've asked another technician to stay a little bit 30 minutes longer than their time, make sure that you thank them for staying late to help you get caught up. Um, Also, do not allow personal differences to interfere in the workplace. So any criticism of an individual's quality of work should be constructive and learning experience. Uh, Sometimes, of course, sometimes workplace shows itself in unintentional rude behavior. So, pharmacy personnel and other healthcare professionals work in busy and often stressful conditions that, of course, sometimes require long hours and involve working in emergency situations. So, sometimes that will happen unintentionally. I have worked for pharmacists before that when they were under a lot of stress, they would just be a little snappy. Uh, I do not ever take it personal because 9 times out of 10, the pharmacist, as soon as it slows down, they apologize. And I've had many pharmacists say, "I'm sorry, I was just very stressed and trying to get these customers out within a reasonable time frame." Um, so maintaining courtesy in spite of rudeness is a mark of a pharmacy technician's professionalism. So like I said, excuse me, it is important not to take it personal if under stressful or emergency situations someone it may sound like they might be being rude. A lot of times it is unintentional and they do apologize afterwards. So it doesn't happen very often, but it may. Always use the title doctor where appropriate. So always refer to physicians, chiropractors, osteopathic professionals, dentists as doctors. Also a pharmacist. So some pharmacists, or most pharmacists nowadays have doctorate degrees or doctor of pharmacy degrees. So uh, when you have a pharmacist, of course, that has received a doctor of pharmacy degree, they should be addressed as doctor as well, especially in front of the patients. Some pharmacists will tell you, you just call them by their first name. But when a patient is there, make sure that you call them by Dr. Goad or Dr. Gates or whatever their name is. So keep your interactions formal until you are requested to do so otherwise. A pharmacy technician, of course, should never advise customer about medications and their use, including OTC drugs and diet supplements. The only things a pharmacy technician can do is read the labels, okay? If they have any further additional questions, it is not something that you can read to them. Make sure that you always refer them to the pharmacist. Refer to the pharmacist any questions involving patient assessment or the proper use and effects of medications. Pharmacy technicians can answer basic information that is already readily available on the OTC or over-the-counter package. So a pharmacy technician, of course, can read the OTC information from the package, and they can show them where the OTC generic medications are located on the shelves, but they cannot offer any type of advice outside what they are reading. So do not provide medical advice. Direct questions should always come from the pharmacist. Go to the pharmacist. So pharmacy personnel, of course, may be called into action during emergency or disaster situations. So pharmacies can help plan specific responses to emergency situations. Roles and functions of pharmacy and other professionals are validated through a crediting process or credentialing process. So if you have a specialized training such as CPR or an ACLS certification or experience as an EMT or as a medic in the military, then you should be an asset, of course, to your community in a time of any type of health crisis. And credentialing is the process for validating the qualifications of licensed professionals such as basic life support and your ACLS, which is your advanced cardiac life support. So some questions to think about while you're studying is why are decorum and etiquette important in the pharmacy? And what should the pharmacy technician keep in mind when communicating with colleagues and superiors? So, and I always think about these are things there's many answers you can come up with this, but I always treat people the same way I want to be treated. So here's our next outline that we're going to talk about on the HIPAA Act, which is the Health Insurance Portability Accountability Act. Patient identifiers, what are they, and patient confidentiality. So HIPAA, of course, is the law that was passed in 1996. So it is a federal law passed in 1996 to protect all patient identifiable medical information and health information. So HIPAA requires pharmacies to maintain the privacy of protected health information, and they call it PHI, and most comply with the regulations. So pharmacy staff must remove or conceal from view any patient identifiers. So some things you need to do is shred all patient related information before disposal. Black out patient information on used prescription vials. So, if you have prescription vials that you're throwing away, because some people will bring in the refill bottles, their bottle's empty, and they'll say, I need this refilled. So then you have the bottle. So you throw it in a trash can. But then what if someone goes through your dumpster? And that does happen a lot. So it is important that you take a black magic marker and mark the name out, the RX number, and anything that identifies that medication to that patient. In the pharmacies where I used to work at, they always had a specific container that anything that contained patient information went into that container. That bag had a special color-coded bag. We sent it back to the company, and they shredded it for us. Okay. Some pharmacies, you may be required to shred it in the pharmacy there. Okay. So failure to comply with the HIPAA regulations can result in severe criminal penalties and costs. PHI, of course, is the just remember, your pharmacy is going to be required by law to maintain privacy of your protected health information. So it is a medical information that is protected by HIPAA, such as medical diagnosis, medication profiles, and results of laboratory tests. So the PHI must be protected from unauthorized use and access. So a physician, nurse, pharmacist, pharmacy tech they all have access to medical information to serve, of course, the needs of the patient. All healthcare professionals are going to be bound by law and ethics not to dissolve or disclose this information outside the workplace. So, in other words, if you work in a pharmacy and you see John Doe come in and you know John Doe, you can't tell one of your friends that does not work in the pharmacy some information that you found out about him. So, you do have to keep it within the pharmacy because they can sue you for disclosing that information outside of the pharmacy. Patient identifiers are going to be any demographic information that can identify the patient, such as the name, address, phone number, social security number, medical identification number. Also, some that's not listed in here is your email address, because that can identify a patient, a photo of the patient, fingerprint, insurance card information or number, and their license number. So all that information is considered patient identifiers. So to be compliant, healthcare workers must remove or conceal from view any information that can be identifying the patient. All healthcare professionals, of course, must understand the importance of maintaining patient confidentiality. Some patient information needs to be shared with the healthcare professionals for insurance reimbursement for drug studies. All pharmacies, of course, must have a written policy on patient confidentiality that must be signed and recorded for a certain number of years. Electronic transmission of data is common in the pharmacy. It improves revenue of a community pharmacy because it allows for more prescriptions to be filled. It also allows you to fill the prescriptions more rapidly. Or you get a more rapid reimbursement. Also, fewer claim rejections as well. Contains cost, so you have fewer personnel, of course, that are needed for billing claims. Provides better patient care, so it allows more time to review patient profiles and more time to cancel your patients. Efficiency of transmitting information electronically must be balanced with the need to maintain data security and protect patient confidentiality. The pharmacy technician, of course, should use common sense, so they should be sensitive and respectful of customer privacy as regards to health information. Display a professional, no-nonsense attitude toward matters that might be embarrassing for the customer. So customers often find that asking about certain products, such as like condoms, feminine products, bedpans, hemorrhoid medications, to be embarrassing. And you should respond to the customer's questions about these products with promptness, courtesy, and respect. And this will, of course, often relieve the customer's embarrassment as well. Matters of medication history discussed in the pharmacy require the same amount of privacy as in the doctor's office. So this information is not to be shared with family members without written approval by the patient. And this can cost you your job. So if you know Mr. Arnold comes in and he can pick up for his wife's medications, but if he has questions on what it's for and what does it do, the pharmacist is not to give out that information to him without his wife's written permission. Okay. Be careful to keep your tone of voice low so as not to broadcast sensitive information to nearby customers. Most pharmacies have a patient confidentiality area or a patient counseling area where the pharmacist can actually counsel the patient, or they can go to ask the pharmacist questions without being overheard by a lot of people. So when the pharmacist or pharmacy technician is giving them that information, you want to make sure that you keep your tone of voice low. So privacy should be maintained as you update customer information, update history records, or verify information such as when someone's dropping off or picking up a prescription. Also, many pharmacies have, like I said earlier, a private area where private information can be taken or where the pharmacist may counsel the patients. Pharmacies are required to have a policy defining patient privacy rights. So patients, of course, may be asked to sign a notice of privacy practices to show that they have read and understood the pharmacy's policies. So these policy statements should be explained to all new pharmacy customers at that same time that they first are at the pharmacy or drop off or pick up at the pharmacy. So parents can sign for their children if they're under age 18. Under age 18. I apologize, I'm getting tongue tied. So that's the notice of privacy practices. Pharmacies, of course, should have policies and procedures to cover HIPAA regulations. So the notice of privacy practices also includes the PHI rights. State laws, of course, also govern patient confidentiality. The pharmacy technician, of course, should know the pertinent laws of his or her state. So just remember, both state and federal law is going to govern patient confidentiality. Where there's going to be conflict, or where conflict exists, the most stringent law or the most strict law is the one that should be followed. What should the pharmacy technician do to ensure the confidentiality of patient information? These are things we've already went over, such as if they have a refill bottle that they drop off, you want to make sure that you black out the name or any type of information on that bottle before you throw it away that identifies that patient. You can also shred papers as well, and etc. So that is the end of chapter 13. If you have any questions, please let me know. Be sure to complete the chapter 13 quiz off of your CD and email it to me. Make sure that you do have an internet connection prior to emailing it. So make sure you do that quiz online through your study partner CD. Email it to me, and then take the chapter 13 test. Okay. If you have any questions, please let me know.